Greetings everyone, Dr. Melanie Crites here with 360 Pelvic Health Institute and the Center for Men's and Women's Urology, coming to you with another segment from Portland, Oregon. And I wanted to talk to you today about something that I see very commonly in the office here with ladies who have generally undergone menopause. So they've stopped having periods, the vaginal estrogen level has dropped, and they can develop a condition called a urethral caruncle. Now, what that is, it looks like a polyp of the urethra. So the opening from the bladder to the outside of the body is called the urethra. And that opening can have mucosal lining that will prolapse out. So meaning if you think of like a tube sock turning inside out, the lining of the urethra can become floppy and it can start pouching out the opening of the urethra. A lot of patients will come in and they'll say, I feel a bulge at the opening where I pee, or I'm having some bleeding and my doctor sent me in for evaluation of bleeding, or I always feel like I have a urinary tract infection because that area is always very sore and very sore to touch. Or I never see blood in the urine, but I do see blood on the toilet paper when I wipe. All of these things can be an indication of a urethral caruncle. And the only way to know if you have that is for a physical exam, so a vaginal exam. And they are generally very prominent. They can range in color from being a light, fleshy red color to being as bright red as a cherry or as dusky blue like a plum that would indicate that it's irritated and bleeding, much like a blood vessel. So having said that, what's the treatment for it? Well, it can be incredibly irritating to the area and can become very irritated with the chafing and the friction that happens as it protrudes out and rubs against a patient's underwear or pads, things such as that. So what I tell patients to do, if they can use vaginal estrogen cream, meaning they've not had uterine cancer or breast cancer or cancers of that nature, if they are able to use vaginal estrogen cream, we have those patients use the vaginal estrogen cream to help that little polyp caruncle do what we call involute, meaning it helps to shrink it and suck it back up inside so that it's not quite so irritating and bothersome. Now, if a patient cannot use vaginal estrogen cream, then patients can apply a little bit of coconut oil or vitamin E or some of the other over-the-counter preparations that have good things in them like chamomile and vitamin E and vitamin A, and can apply it to the area. That doesn't help it involute or suck back up inside, but it can help to significantly decrease the irritation. Now, for those patients that are on blood thinners or they have a persistent problem and none of these treatments work and they're on blood thinners and they've been diagnosed with a caruncle and the caruncle keeps bleeding, we can remove it surgically either in the office with some numbing of the area or going to the operating room to surgically remove it and put a few stitches in to help remove that area and reduce the surface area that causes the irritation. So if you're somebody that feels like you have urinary tract infections all the time, or you have persistent blood on the toilet paper, or things just feel irritated down there, you might want to check and have your doctor check you to see if you have a urethral caruncle. They're generally not malignant, so not cancerous in nature. They're more irritating. They are generally a perfectly benign condition, but can be quite irritating. However, they are completely treatable. So I hope this helps. I see a lot of this in the office. So as always, everyone, keep writing in your questions. And again, as always, thanks for letting 360 Pelvic Health help restore your confidence.